Okay, we're ready to begin. Smitha?
Hello, everyone. I would like to welcome you to the Suicide Prevention Resource Center's webinar on making your grant project successful, how to make your objectives SMART. This webinar is being recorded and will be posted on the private pages of SPRC's website after today. During the webinar, we encourage you to use the chat function on the lower left-hand side of your screen if you have questions. Throughout the webinar, please type your question there and we will answer them throughout the webinar. There will also be a question and answer session at the end of the webinar. I'm now going to pass it on to Zoe, who will show you some of the technological features of the webinar platform. Zoe?
Hi, welcome to the webinar. If you have any technical problems, please call SPRC at 617-618-2380, or you can call Adobe Connect at 1-800-422-3623. These phone numbers are also at the bottom of your screen and in the registration emails we sent you. You can also type any questions or comments at any time in the text box in the lower left-hand corner of your screen. I'm going to just hover a little arrow. It's sort of, I can't bring it all the way down, but in that little box right above everyone, if you just click in there and type and then hit return, we will get any questions that you have. And finally, you can make the presentation screen larger at any time by clicking on the full screen button, which is in the upper right-hand corner of your screen. I'm hovering the green arrow just underneath where it's located so that you can see the presentation larger. And you can click it again if you want to go back to your regular opening screen. And I'll now turn things over to Ellie Stout.
Great. Thanks, Zoe, and thanks, Smita. And welcome to all of you who are joining us today from across the country. My name is Ellie Stout, and I manage the prevention support team here at the Suicide Prevention Resource Center. And today I'm joined by Smita Varya, who you just heard, who's going to be moderating today's webinar, as well as Gail Jaffe, who's one of our senior prevention specialists, and she'll be co-presenting with me. And as I hope most of you know, today's webinar is part of a training program that SPRC has designed for the new Cohort 7 State and Tribal Grantees. And through this program, we're offering you a combination of reading, webinars, exercises, and consultation that we hope will help you start your project off on the right track. Today's event builds on the two reading materials we asked you to look at on logic models and SMART objectives. And I know we've been adding folks to our distribution lists over the past couple of weeks. So don't worry if you haven't seen those yet or if you didn't have time to take a look. We'll be touching back on the main points in a few minutes before we go into some activities. First, though, some of you may be wondering why we're talking about objectives today. After all, you put some objectives in your proposal and it got funded. So right now, I bet you're all thinking about how you'll implement everything. But there are several reasons why we'd like to ask you to take another look at your objectives as you start out your grant. And the first and most obvious, perhaps, is that the proposal was written some time ago, in fact, over a year and a half ago. And so even if you were centrally involved in writing the proposal, sorry, I understand I'm a little quiet. Even if you wrote the proposal yourself or were involved in brainstorming what went into it, it's worth going back to refresh your memory about what it was you were planning to do. Second, you probably are hiring new staff now that your proposal is funded. Perhaps some of those folks are joining us today. And the staff working with you to implement the grant will need to fully understand your objectives inside and out so that you're all on the same page. And finally, ensuring you have a clear understanding of your objectives can be really helpful in planning your local evaluation. Without a clear picture of what it is you're setting out to do from the start, it can be difficult to figure out if you've been successful at the end of the grant. I do want to emphasize that today's session is not meant to encourage you to change your objectives. That would be a last resort if something really isn't working out, and it's something you'd need to talk through carefully with your SAMHSA government project officer. So instead, today we're going to be giving you some tools that will help you clarify your objectives for yourself, for your staff, your partners, your evaluators, so that, again, everyone is on the same page about what you hope to accomplish in these 3 years. For those of you who are already familiar with some of the concepts we're talking about today, we do hope you'll speak up and participate so that the group can benefit from your experience. And for those of you who are new to some of the content, as Smita said, we do encourage you to ask questions as we go using the chat box. But before we get started, we wanted to ask all of you to share how involved you were in writing the proposal for your Garrett Lee Smith grant. So I'm going to ask Zoe to pull up the poll that we have for you. And I'd like to ask you to click on the little dot next to the description that best fits you related to the grant proposal for the Garrett Lee Smith funding. And we're going to give people a couple of minutes. Click on your answer, and then we'll show everyone the results. I'm just going to wait a few more moments to make sure everyone has time. And unfortunately, can't pick multiple ones, so we'll ask you to pick the one that is closest to you. I see some people changing answers. All right, let's go ahead and broadcast those results. So it looks like there are a number of folks on the webinar that are very new to their role on the grant. Happily, it seems like everyone has read the proposal, so that's good news. I thought maybe we'd have someone who was just hired, who hadn't had a chance to yet. And then about half of you were involved in writing the original grant, and that's really great. So regardless of how you were connected to the original proposal, I'd like to take the whole group through some logic model and SMART objectives basics that are tools that can help you reconnect with those objectives and clarify them with your team. So we're going to start with logic models, and I know when I say this word, it often strikes fear into people's hearts. I'm sure we've all seen very complex logic models. Perhaps there's one in your own proposal. And some people have really developed an aversion to logic models. But even though they can get pretty complicated, I'm a big fan of logic models. And so I'm just going to touch briefly on why. The idea behind a logic model is really simple in that it helps you make sure that you've thought through your program and that logically your process or the activities and resources you're putting in would lead to the outcomes you're hoping for. So that would be, in our case, changes that contribute to reduced suicide. And the logic model helps you just think through your logic, make sure your assumptions are sound by helping you think through step by step why you expect your activities to lead to the change you want to see or your outcomes. So I'm just going to take you through a quick example, and then I'm going to ask you to help me flesh out some assumptions in a couple other examples. So this is a phrase that we might commonly see grantees say: if we distribute materials with the National Lifeline number, people will get the help they need. And certainly there's reason to think this, but what are the hidden assumptions here that might be helpful to clarify, particularly as you start planning how you're implementing your program? Well, oops, and I apologize, the little E went into the next line. If we distribute Lifeline materials, we might assume that people will hopefully pick up and read those materials. If they do that, we're assuming that their knowledge will be increased around help resources, in particular the Lifeline number. And then we're making an assumption that people will call the Lifeline if they or a loved one are in crisis. So that is really, all of those pieces are necessary before people can get the help they need, both over the phone and hopefully through local referrals that are made. So I'd like to ask you to help me think through, using the chat box, some of the hidden assumptions in this next phrase that might also be common to many grantees. If we train school staff as gatekeepers, at-risk students will get the help they need. So what would you say are the missing links between gatekeeper training and people getting help? What would we expect to happen first if we train school staff? I see people are typing. Thanks for participating. Everyone's typing a lot. So for instance, one thing we might assume is that, students will approach staff. That's true. That's an assumption that the people we're training are people that students will go to. We could also assume if we, oh, here we go, educate the school staff on referral processes and or agencies. That's right. So we're giving school staff knowledge. We're assuming they're learning how to make appropriate referrals. We might also be teaching them some skills around how to identify at-risk students and how to talk to them. Anything else missing here? I see to contact them that gatekeepers are accessible. Absolutely. And school staff will know that it is important to have this knowledge. That's true. Certainly awareness of the importance of suicide prevention is important, and knowing the signs. The other thing I can think of here is that, that the referral resources actually are prepared to see the students. Oh, and very important that the training is culturally competent. This is great. You guys have a lot of ideas, and I think you can see the value of sort of thinking through some of these assumptions. And I'm going to move into the next one now, which also we've seen grantees sort of make this connection a lot. If we get a public service announcement on the radio, young people will talk to an adult about their problems. So what are we assuming here in between the lines? See, some people are typing. It needs to be on a station that youth listen to. Absolutely. What else are we assuming if youth listen to it? I think some of the comments from the last one also apply. Let's see. There's a good relationship between parent and youth. Right. Do young people have someone they can talk to? And yes, that the message will resonate with youth. Absolutely. So I think you get the idea. You guys are already way ahead of me here. But I think it's worth revisiting some of your own objectives and thinking some of the assumptions through there as well as you start planning your program. But you guys are definitely with me there. So what we've just been thinking through, I think you can see, are fleshing out some of the key components of a logic model. So this is the map of the basic structure of a logic model that matches the reading that we asked you to take a look at. So basically, the inputs, activities, and outputs should link to the outcomes that you want to see. And of course, for all of us, the overall program goal is to reduce suicidal behaviors. And to do this, Garrett Lee Smith programs work on increasing protective factors and reducing risk factors. So those are our long-term outcomes. And we talked a bit in the previous exercise about the short-term and intermediate outcomes of people intervening or talking or making the call to the lifeline, taking action to make change in risk and protection. So I'm going to now turn it over to Gail, since you might be a little tired of hearing me talk. And we're going to pull up the whiteboard. And Gail is going to take you through a few real-life objectives from previous grantees. We're going to ask you to identify the risk and protective factors that might be affected through these outcomes. So Gail?
Thanks so much, Ellie. Hi, everyone. I hope you can hear me okay. Please let me know if you can't. So at this point, we are going to take a look at some of the objectives that are up here and think about some potential long-term outcomes. So the first objective is to train 100 high school faculty and staff as gatekeepers. And I'm wondering, you guys have been great so far in terms of participating and contributing some responses, and I see at least one person is typing already. What kinds of long-term outcomes would we be looking for here? Maybe someone else is typing as well. So I can sort of, oh, here we go. So that by training the faculty and staff, a system of support would be developed. Yep, so that could be one. Ellie, were you going to be typing these into the whiteboard?
Yes, I am. Can you see it?
Yes, now I can. Thank you. Sorry.
Thanks.
And that capacity is developed to address the issue of youth who are at risk for suicide. What are some other outcomes that people can think about here? I know that with some of these programs, the training of faculty and staff as gatekeepers help for these adults to be identified as people that youth can go and talk to. And so that's a desired long-term outcome to happen. I know I see a couple more people who are typing too.
As people are typing, this is Ellie, sorry to interrupt, Gail. I'm wondering if we could go even further down the outcome chain to think about risk and protective factors that might be influenced by some of the actions that people are taking.
That's a great point. I'm wondering, like, as people are typing in, if you are thinking about looking further ahead and targeting specific or changing specific risk and protective factors and really responding to that too. Keep seeing people like in the process of typing and then the answer isn't showing up. So I'm going to give people another minute or so to respond. Here we go. Here's another response. So broad-based school group is prepared and engaged to address the topic. And then I also see another response here that looks like it could be partial, but change in mindset to be willing to come forward. Really changing the climate of the school and the acceptability of students feeling like they can come forward and they can talk to adults. And I would say vice versa too, that faculty and staff would also feel more of a willingness to talk with students, to be thinking more about prevention as well. And I'm also seeing a couple more earlier identification of kids who could be at risk. And, again, kind of decreased stigma around seeking help. And then I see another one where gatekeeper training itself is a more limited objective, maybe thinking about other methods that could be introduced for other outcomes. So
having this objective lead to, to other initiatives such as policy development, screening of students. So really kind of taking the activities in a different, more, macro in some cases level, or really looking at trying to reach students in a different sort of way. So Ellie, I'll give you a second just to catch up with any more typing on the whiteboard, and then I'll move us along to the next objective, unless there's anything additional that people want to get in here while Ellie is typing up. I see increased peer supports. So thanks, everyone. These have been great. Okay, Ellie, are you okay with us moving on?
Yep, thanks.
Okay, awesome. So let's take a look at the next objective here, which is to establish memoranda of understanding with community mental health agencies. And what sort of outcomes will we be looking at there with creating these agreements with community resources, which may already be a part of the grant project that you have up and running at this point, or it may be something that you're in the process of working to do. So I'm seeing here the development of an effective referral system, definitely. Expanding supportive services. And increasing the ability to access care quickly, which is definitely key if you are talking about training people, say, to be gatekeepers or doing any sort of screening program. I'm sure I don't need to tell you that. Also, like Alan just touched on what I said, so having the support for screenings and a place to send kids when they either do screen positive or when a gatekeeper, has this, when someone who's trained as a gatekeeper has decided that that a youth is in need of some additional support and possible assessment. Okay, so I'm also seeing that that establishing these memoranda could be a way to get some training in for clinical staff in terms of managing and being able to assess and manage suicide risk. And it's also a way to develop a collaborative relationship to increase the cultural competency of partners. That's definitely something that could happen here and something that's really important, certainly. And increase partnerships for follow-up on treatment, for sure. And then potentially, and this can get a little bit tricky depending on exactly what it is that's in your memorandum, but increasing data sharing between entities. I think that that's something to be really mindful of. It's kind of a topic for a whole other webinar, but it's definitely something to be mindful of if that's something that you're looking into doing. And, with establishing these, having a clear understanding of both parties' responsibilities and expectation of each, it looks like the role of each of the players. So these are all qualities for sure of establishing of MOUs and what you would want to accomplish in the process. And then, just to sort of touch on, again, the clinical training piece, a mechanism for behavioral health staff to train other professionals, too. So more support for the clinical training piece. Okay. All right. I thought I had someone else typing, but I think we are going to move on to Objective 3. And what we're sorry, my screen just froze. What we're looking at here is implementing the American Indian Life Skills curriculum in the community high school. So that's the objective that we're looking at, and what would be some of the long-term outcomes. And if you're not familiar with this program, it is a best practices program. You could substitute, implementing a different sort of curriculum in a community high school. So we see here increased knowledge of generational trauma risk factors. That's something that you could do here. And it also looks like increased preventive approaches for youth. Definitely increasing coping skills. It's a big component of a life skills curriculum like this one, for sure. And along those same lines, the youth would be better able to make good life choices. All right, I see a few more people are typing here, so I just want to give you a chance to get your answers in. Better connection to community and culture. That's definitely, something that's a component with a program like this, and so that could certainly be expected, in terms of an outcome here, at least something that you would anticipate being able to achieve. So I do see the cultural and spiritual grounding, and there being cultural adaptation for tribal communities as well in terms of the content. All right. I think that we are about ready to move on from this one, but thank you so much for everyone. These have been really great suggestions from all of you in terms of the anticipated or hoped for outcomes from these 3 objectives.
Gail, I'm just going to move you back to your presentation.
Okay,
Okay, you're all set.
great.
It's all you, Gail.
Thanks, Ellie. I was just going to say, at this point, I am going to be talking with you all about what we mean when we say SMART objectives and what that means for measuring success. And the second document of the 2 resource documents that we had sent out in the emails and as part of the training program really gets into a little bit more detail about what's meant by SMART objectives. And so I'm going to take you through those and just provide a little bit more explanation, I think, in order to help further your understanding of how these can be useful to your projects and to looking at your objectives. So if you have read through that document, this is going to sound very familiar. And if you haven't, I'm hopefully going to hit on all of the key points that you would have seen in this particular resource. But I would definitely encourage you to go back in, at least for reference, because we think that it's pretty valuable. Okay, so SMART objectives. So SMART is an acronym, and it stands for specific, measurable, achievable, realistic, and time-phased or time-framed. And the last one, we felt like the terminology was a little bit, I don't know, time-phased sounded a little bit clunky, but basically looking at a timeline, and we wanted to just use the same language that was used in the evaluation brief that was sent out. So in thinking about writing SMART objectives and possibly reframing your objectives so that they do meet these criteria, there are a few ways that you can do that. You can start out by looking at them and making sure that each objective is specific. In other words, it's something where you'd be able to identify a who and also the what of program activities. And in these, you'd really avoid verbs and other language that might have vaguer meanings to describe the intended outcomes, and instead use language that would actually document some action. And for example there, instead of saying, that such activity would increase understanding, you would say something along the lines of, at the end of this particular activity, the youth will be able to list these 3 things. So really getting as specific as possible, because the greater the specificity here, the easier it'll be for you to actually measure this and to look at this in terms of your success criteria. So this should get anybody who's concerned with evaluation activities very excited right now, and it should really get all of you excited, because you're putting so much effort into your programs, you're going to really want to make sure that you're able to evaluate them as best as possible. In terms of measurable, there the focus is really on how much change is going to be expected. And these objectives, to the best of your ability, should really quantify the amount of change that you are looking to achieve. And so the objective would provide something along the lines of a reference point from which the change in your target population can be clearly measured. And that's something that's really key here, again, in order to be able to get clear for yourself when you're thinking about breaking down your activities and looking at the logic model and thinking about the different steps, but also always having an eye towards evaluation and how you're going to be able to measure your own success here. So the A, achievable, this one is a little bit, sort of more straightforward. It's really sort of thinking about your objectives being attainable within a given time frame and with the available resources that you have to your programming. It seems like one of those things that's a bit of a no-brainer, like you would only really want to create objectives that you would be able to achieve and to be able to realize during the course of your program. But it's also one of those things where I think sometimes it's easier said than done, and people, I think we all have kind of the best intentions, but sometimes it's a lot easier to kind of bite off more than you're actually able to chew. So really thinking about your objectives and creating them and framing them along these lines will really help you in order to realize everything that you're looking to realize in terms of outcomes, or at least getting pretty close to that. So are realistic, thinking about objectives being the most useful when they are really accurately reflecting the scope of the problem and also some of the programmatic steps that you can implement within a specific time frame. So again, I think that this is pretty closely related to achievable and taking on something that you really feel fairly confident that you'll be able to accomplish during the life of your project or during the specific timeline that you're setting out. And then in terms of the last one, time phased or time framed, the objectives should all provide a time frame that reflect when they'll be measured or a time by which they'll actually be met. And this is really key in terms of helping to plan and evaluate your program itself. I'm not sure if anybody has any questions at this point about the SMART objectives. I know that we're going to be transitioning into some broader Q&A at this point, but that's essentially the meat of what SMART objectives are about. All right, I don't see anything.
Oh, sorry, Gail. If there aren't any questions at this point, we actually have one more activity planned before the Q&A.
Okay.
So I can take it from here if no one has questions. So,
that would be great. Thanks, Ellie.
And thank you, Gail, for the overview of the SMART criteria, and definitely seems very simple, but it's not always as easy to apply in real life. So I'm going to ask Zoe to pull up a poll. We're going to ask you to apply the SMART criteria to a few objectives we've pulled from past grantees, and I'd like to look at the top one first. So by July 2015, increase early screening among youth ages 10 to 24 who are at risk of suicide in the community. This time you can actually select multiple choices. So please click on the SMART criteria that you think this meets: specific, measurable, achievable, realistic, or time framed is my preference. And you'll be able to see the results as you vote, and I'm going to give people a couple more seconds. We have plenty of time before I call it. Can they see the votes? Okay. All right. So as the last people opine, and people are already scoring the other one too. Great. So the first one, the July 2015 one here, it looks like definitely there's some time specificity. And you can see that some of the other criteria are a little bit more perhaps subjective. So it is somewhat specific, but there are some other pieces missing. Perhaps what kind of early screening, what are they talking about, which youth, and how would they be identified as at risk. And then the measurable, achievable, realistic definitely got the lowest. So maybe that's a bit ambitious for a 3-year time frame. And it looks like measurable and achievable, sort of some people thought you could measure it, certainly an increase if you were doing screenings in schools or in a mental health setting. Perhaps you could track an increase, and achievable might depend on how open the community is to it. And I see people have already been voting on the next one: train 20 staff members of local LGBT organizations as gatekeepers. And so here we see that there's some specificity. I'll let people continue to vote. There's no time frame. That definitely is a little bit missing. And then people really do feel like this is measurable and achievable, and perhaps realistic, maybe not so much. So this definitely is measurable because you can count the people you've trained, though definitely thinking back to our logic model thinking, it might be nice to think about what we want those staff members to do once we train them. So if you could pull up the other two, Zoe. So the next one is, by the end of the grant, increase by 20% the percentage of youth who can identify at least one resource to turn to when they have suicidal thoughts. How are we doing there? Definitely looks like measurable is scoring very high. Achievable, realistic, maybe a bit lower. It's a very ambitious goal. There's definitely some time framing to it. And interesting that people don't feel like it's quite as specific, perhaps, as it could be. So that's great that you guys are thinking more specifically. Great. And there's one more: increase collaboration with community partners. So here, it's a little less detailed, perhaps, than some of the other ones we've been looking at. Definitely people feel like it's achievable, definitely, right? Because it's not so specific. So if you increase collaboration with one partner, you're already there. So I just thought this might be a helpful exercise to apply to the criteria to other people's objectives, and kind of see the variation in our own opinions of whether it is measurable or achievable or realistic. So we're all coming from different backgrounds, and so as you see, applying the criteria isn't always as simple as it looks. So now I'm going to turn it over to Smita, and we'd love to get any comments or questions from you. So I'm going to turn it over to her, and she's going to moderate our Q&A session.
Thanks, Ellie, and thanks, Gail, as well. And I also wanted to thank all of the participants for participating in all of our different activities. And so now we're just going to take about 10 minutes for general question and answer. and your phone lines will remain muted. However, again, please use the chat function on the left-hand side, and as your questions come in, I will read them aloud. So at this time, if you have any questions on logic models, on SMART objectives, on anything that we have gone over today, please feel free to chat them into the chat box at this time. So we'll take a few minutes and see if you all have any questions. And it looks like we have one person typing in a question and a couple more people. Um, and as they're typing in their questions, one thing that we wanted to stress is that a lot of you are probably wondering how can we really take this information and make it applicable to our grants. And, a lot of previous grantees have focused on doing activities around awareness campaigns, around gatekeeper trainings, around peer leadership or natural helper programs. And really, we'd like you to take the information you heard today and really think about those different activities. Why are you doing them? How do they relate back to your objectives that you wrote into your grant proposal? To really think about what differences you want to make in the community. Do they meet the SMART objectives? Are they specific? Are they measurable? Really thinking about how are they realistic. And, some of the things you can do is really to look at the data, do the climate survey. A lot of people will say, we want to eradicate suicide in our community. Well, obviously that's not realistic. So, looking at the data and trying to figure out what audience is best to target um, can really get you some of the results that you are looking for. So I see here that we have a couple of questions. Um, Rose is asking, it sounds like you feel it's appropriate to update and or change the objectives as new staff is included in the implementation of the grants. And again, at the beginning of the webinar, we did say we're not asking you to change your objectives, but to really um, think more critically about the objectives that you have and look at them to see if they are SMART objectives and to look at the logic model itself. Um, Gail or Ellie, do you have anything to add to that?
This is Ellie. Yeah, I know it feels maybe a little bit like a mixed message, but really what we're trying to provide today is some tools that will help you and your new project staff, if they've recently come on board, get a better shared understanding of the existing objectives. So that last one we looked at about increasing community collaboration, that's your official objective with SAMHSA, and that doesn't necessarily need to change. But what do you mean by that? And so hopefully for your own work, you can clarify that a bit to make it a little more specific or realistic or some of the other SMART criteria. If you actually were to change your objective and say we're not increasing community collaboration, instead we're doing this other thing, that would require some justification, and that's not something that we could help you with. That's something you would have to negotiate with your government project officer at SAMHSA.
Thanks, Ellie. And I hope that answered your question, Rose. Another question is, should there be a specific date, for example, by July 31st, 2012, rather than by the end of the grant? Do you need to have a specific date for it to be measurable?
So this is Gail, and I can take that question. It's a really great question, and I think that it really depends largely on what you're talking about in the specific objective as it pertains to an activity. So you may actually start out by saying, by the end of the grant, we intend to train, X number of people. You'd probably need to at least break that down by year in terms of, the evaluation piece and putting it into your annual report, but also so that along the way, it's easier to chunk up the time and to see how you're doing in terms of, meeting your interim goals and things like that. but also, there may be certain things that that just are a little bit more time limited by their nature. So you could say, by June of 2013, we're going to involve so many youth in this particular initiative, and they'll have kind of graduated from our program. And so again, I think that whether or not you say by the end of, the first year, by the end of our grant project, or by, the end of December, it depends on what it is that you're talking about doing. So that's probably the most specific answer I can give to your question. I think that when it comes to putting an actual timeline in place, though, again, being realistic will really be useful too. You can, there's always some flexibility to talk with your program officer if things aren't progressing, as quickly as you might have anticipated that they will, or if you've already met and exceeded the numbers that you have said that you were going to achieve, and so you just want to recalibrate a bit. So I do think that that being specific can be really useful. It's just a matter of really thinking about your particular project and the community where you're working, and the resources available and other factors, and thinking about what's going to be the most realistic and the best fit.
Thanks so much, Gail. And we are getting some props on the left-hand side saying that the webinar has been helpful and clear, and that they appreciate how interactive this webinar has been. So thanks so much. And Alan has written that a resource for people to look into is Bloom's taxonomy action verbs. And it's a list of words to use that are measurable terms. So that might be a good resource for people. And we do have a couple more people typing in some questions. Liz has asked if there will be a copy of the PowerPoint. And yes, this webinar is currently being recorded, and we will be posting the PowerPoint slides on the private pages for on the SPRC website, and we'll be sending out an email over the listserv once the presentation is up and available for you all to download. And also just a reminder that any questions you have about SMART objectives or your logic model, you can definitely ask your prevention specialist. Most of us are also on the line right now as well, so we encourage you to talk to your prevention specialist if you have any questions about specifically to your objectives and goals and activities around this. And again, my mistake that the presentation will actually be on the public pages of the SPRC website, not the private pages. So again, we'll be sending you that link out over the listserv. And we still have a few more minutes. Does anybody have any other further questions? And I don't see anybody typing right now. So what we can do is we can move on, and I think it was Alan who mentioned the Bloom's resource, and Gail has added the link on the left-hand side, so please take a look at that if you would like to. And I guess we can move on to the next bit that we have on the webinar to close today's webinar. So I will pass it on over to Ellie.
And don't leave yet, because this is one last important piece. The next step, since this is part of a training program, is that we would like you to go ahead and apply some of what you learned today to your own program. So right after this webinar, you'll receive an email with this worksheet attached. And if you've recently joined and you're not on our distribution list, and you for some reason don't receive it, please let me know and I can send it to you. Our contact information will be on the final slide. So over the next few weeks, we're hoping you'll work together with your team and perhaps even your really close program partners to think through your original objectives in your proposal and to try rewriting them as SMART objectives. And again, this isn't a formal change to your grant. This is an exercise for you to kind of get that clarity before your team really starts moving forward. As we mentioned before and saw a little bit in that last poll, it can be tough actually writing SMART objectives, so it's great to have the resource that Alan mentioned. But we also have a couple of opportunities if you get stuck to get some help. We'll be holding a consultation session in a couple of weeks on October 11th, and we'll ask you to sign up ahead of time for that if you're interested so that we can really focus in on any questions or challenges you're experiencing. And then you'll also have the opportunity to talk with your own grant support team, that is your government project officer, your prevention specialist, and your cross-site TAL on monthly grant calls that will be starting up in the next few weeks. And certainly take advantage of that opportunity to ask any questions or share some initial drafts for feedback. And we're hoping that you and your team will have a chance to complete the exercise and sort of have some SMART style objectives by the end of October so that we can kind of more formally perhaps look through them in those monthly calls with your project officer and your prevention specialists. And then the next step will be sort of prioritizing what you're going to be doing in the coming year, because sometimes when you have a lot of objectives, it's good to start in with just a few and move to the next couple in the following year. So that's where we're headed. You should get an email right after the webinar. And thank you all. Just before I turn it over to Smita for closing, this has been a very interactive webinar, and we haven't always used all of these tools in the past, but you guys have been great participants. So thanks again, and I'll turn it over to Smita for the closing.
Thanks, Ellie. And again, thank you all for participating in today's webinar. I don't think it would have been as exciting as if you all didn't participate, so we really appreciate the interactivity and you all taking the time out of today's schedule. A reminder again that this webinar has been recorded and will be posted on the SPRC's website in a couple of days. And again, please keep an eye out for the exercise on making your objectives SMART that you will receive in an email after today's webinar. And